Hello everyone, Assalamu alaikum wa rahmatullahi wa barakatuh. This is Dr. Sana. Welcome back to my channel. Today we are going to discuss about female reproductive organ, vulva, its normalcy and abnormalcy. Okay, let's know about your vulva. The vulva refers to the external female genital organs. It protects the reproductive tract and plays an important role in sexual function, urination, and protecting from infection. We have a model of vulva over here. This is the anterior part or the front part, and this is the posterior part or the back part. Let's look into the parts of vulva. First one, labia majora or outer lip. It is the labia majora. The labia majora is the too large outer portion of the outer part of the or outer folds of the skin. It is where the hairs are grown. Its function is protects the inner genital structures, contains sweat and sebaceous glands, covered with the pubic hairs after puberty. Now let's look into the next part, labia minora. It is the inner lip, okay? It is the thin fold of the skin inside the labia majora. Protects the opening of the vagina and urethra. It is rich in blood vessels and nerves. It swells during sexual arousal, okay? Now let's come to the next part, clitoris. It is upper part of the labia minora. It is where the both folds of the labia minora meets. Okay. Its function is it's the primary organ for sexual pleasure. Okay. In female, it is the primary organ for sexual pleasure. It is highly sensitive organ with more than or around 8,000 nerve endings over here. Okay, it is the primary organ for sexual pleasure in female. It becomes enlarged during sexual arousal. It looks like a minor or mini penis while sexually aroused. With a small head and shaft, it will be similar to a miniature penis. It is the counterpart of the penis in females. Now let's come to the next part. It is prepuce. This is the skin folding that covers the clitoris is the prepuce, or it is called foreskin. The function of this prepuce is it protects the clitoris from friction, similar to foreskin of the penis. Okay. Urethral opening. There is a needle-like opening here. This is called a urethral opening where your pee comes out. Now let's come to the next opening. It is vaginal opening. The larger opening in the vulval area is called vaginal opening. It is the passage for menstrual blood, sexual intercourse and childbirth. Now let's look into the key functions of vulva. The vulva mainly serves to protect the internal female reproductive organs. It allows urination, facilitates sexual arousal and pleasure, provide lubrication during intercourse, serves as entry to birth canal, etc. Important point you should note is vulva refers only to the external genitalia, while the vagina is the internal canal leading to the uterus. Now let's look into the normal appearance and variations of vulva. The vulva or female external genitalia can look very different from person to person. Many variations are completely normal. Understanding this normal helps women recognize when something may happen, something may need medical attention. So let's come to the points. First one is color. The normal vulva color may vary widely from pink, reddish, brown, dark brown or purplish. Changes may occur with puberty, sexual arousal, pregnancy, aging, etc. These color differences are usually normal and healthy. Size and shape of labia. Labia majora and labia minora vary gently in size. Normal variations include one labia minora being larger than the other, labia minora protruding outside the labia majora, small or large labia, wrinkle or smooth textured labia. These are all normal variations in labia. Next point is hair distribution. Pubic hair patterns differ among women. Normal patterns may include dense hair covering the mons pubis and labia majora, sparse hair extending towards the inner thighs. These are the variations seen in labia majora. Hair typically does not exist or grows on labia minora. Okay, that is here the labia minora, the smaller, the thinner layer. Usually the hairs don't grow over here. Okay. Now let's look into the next point, normal vaginal discharge at the vulva. A small amount of discharge at the vulva is normal. Normal discharge is usually clear or milky white. Mild odor, no odor as the normalcy in the smell. Changes for these can occur during the menstrual cycle. Discharge increases during ovulation, during pregnancy, and with sexual arousal time. Okay. Next, look into the next point, normal moisture. The vulva normally remains slightly moist due to vaginal secretions and sweat glands, Bartholin's gland secretions, etc. The dryness is more common after the menopause. The next point is normal sensitivity. The vulva contains many nerve endings, especially in clitoris and labia minora. Therefore, it is normal to have sensitivity to touch, mild swelling during sexual arousal. Okay. Now let's look into the point when you should seek a medical advice. Changes that may need medical evaluation include persistent itching, pain or burning sensation, foul smelling discharge, sores, ulcers or lumps, severe redness or swelling, bleeding not related to menstruation. If you see these symptoms, it may indicate infection, skin conditions, or other gynecological issues. So you should seek a medical attention immediately. Let's look into one important point. Many women worry about vulvar appearance because of unrealistic image in media, but most vulvas look different and still completely normal. Okay, so that's all about the structures of the vulva. Let's stop here. We'll come back with the continuation of this topic in the next video. Thanks for watching. Assalamu alaikum wa rahmatullahi wa barakatuh.